Wait. When Mark comes,
we need to ask those questions.
Yes,
exactly. To just mention those things.
Good morning, Dr. Teresa. It's a pleasure to have you on the Morning Switch.
My pleasure. Morning, Ronnie. Morning, Victoria.
Awesome.
All right, so let's get quickly into it.
Let's get into it, because already, before we even get anywhere as far as ulcers, what everybody know, whether the different cancers, any digestive issues that we're going to be dealing with, please first share with us what a laparoscopic and endoscopic GI surgeon actually does. Meanwhile, I've done an endoscopy before, and trauma. Please tell us what those things are first, and maybe start it off there and tell us about your work.
All right, so you experienced trauma?
It's traumatic.
No, it is not.
Yes, it is. What do you mean I have to swallow a camera?
No, it's not like that, but we'll talk about it. So laparoscopy and endoscopy are sort of like diagnostic tools that we use, and also they can be used for therapy. So laparoscopy is more like my day-to-day work entails operating people with keyhole, incisions, cameras, without having to do the old
keyhole
technique.
incision, you mean like tiny little...
Yeah, like a centimeter or less.
Okay. Wow,
Yeah.
I didn't know they were called a keyhole.
Yeah, then endoscopy is more like a cable, something like very flexible with a camera and light that we use to diagnose and sometimes treat certain conditions of our intestinal tract, as it's commonly known.
Yeah.
So when you add that to being a surgeon, it basically means that I deal with surgical conditions. And that's what.
So before we even get to the common stuff that people deal with, how about you tell us the types of digestive issues that you've dealt with, and are also,
Maybe those that are also common.
Yes, those that are common, but also those that are severe as the cancers of the digestive system.
Yeah, so the common digestive issues are usually the common stuff that people suffer from. It can range from, I would say, sort of like difficulty swallowing to difficulty passing stool. The GI system...
Difficulty passing stool, is it constipation?
Yeah, constipation is defined differently, but yeah, something like that.
Okay.
So, it involves anything to do with the gastrointestinal tract, which is basically sort of like a tube from the mouth to what we call the anal opening. So you can have a wide range of symptoms such as difficulty swallowing, nausea, abdominal pain, which is the commonest, things like bloating, and more severely things like bleeding. Bleeding can be from down or through vomiting.
So abdominal pains are also included within the digestive system?
Yeah. Abdominal pain is the commonest, and it's the most important symptom.
It shows there's an issue in here.
Yeah, things that people commonly complain about: abdominal pain. So but the abdomen is so wide that you have to be, as a doctor, we have to be sure where the pain is, because every part signifies a different organ, so different cause of pain. So
Okay, so where does ulcers come in?
So ulcers, I think, is a very misleading term. It's a misnomer. It's something people commonly say, "Oh, I have ulcers," but for us, it's something very serious. Yeah. So ulcers is it's more like a wound. So it's like saying I have a wound in my stomach. But if you have a wound, that means the wound is bleeding. If the wound is bleeding, that means it's very serious. So most of the times, if you're bleeding, then we need to deal with it. Yeah. So
ulcers are a lot more serious than people let out, or they're saying even it's like food poisoning, and then somebody's like, I've got ulcers.
Yeah. People they mislead us when they come in and say I have ulcers, so you have to be very careful. But basically what people are trying to say is I have pain, and they have a wide range of symptoms. It's never one symptom. It can be abdominal pain, it can be nausea, it can be bloating, it can be diarrhea. So Yeah.
So which symptoms should people actually take seriously that could lead to a serious issue? Like you're saying, ulcers is like, it's very serious. You have like, you're bleeding probably somewhere in your digestives. But what are the symptoms that people should actually take seriously? Because nowadays you just treat everything at home.
Yeah, and that's a problem for us because there's a lot of self-medication. But if you have pain, your pain, the symptoms depend on the duration as well. Duration is very important. If you're okay and then you wake up the next morning and you have severe abdominal pain, that is a very serious issue. If you have pain and it persists for, say, more than 3 weeks, that's also a very serious issue. Those two are not similar, but they signify something. But I would say some of the most important things are, it's a combination of things. If you have pain followed by nausea, and if you have bleeding from any site, that is, let's say you're vomiting blood or you're passing blood in stool of any color, it means something very serious, and you have to come in. Yeah.
If I might ask, when you talk about the opening probably in your, what would cause? Because for someone to get a wound, there must be, say, like an injury. What causes the wounds, the ones we call ulcers, and never get to know?
So ulcers are commonly caused by what people now are starting to know as H. pylori. H. pylori is a bacteria.
He's had it. Almost died. Literally.
No, you won't die.
No, but he was like 5 minutes to the Lord.
That thing.
Yeah.
It showed me Shoki. Do you know, I had never thought about, you need to do a will. That day, it was what I was thinking of. Doctor, I suffered. It's painful.
Did you take any painkillers for that?
No, so what I did, I didn't know. So I get the attack and I had no idea what I was going through. At some point, I felt like, is it a heart attack? What is it? And then there was too much pain. So when I get to hospital, I am told it is H. pylori. And I'm like, what is this? Because they had to do a scan and they had to do all these things. That's how they got to know. Is there an inflammation in the stomach? The layers of the stomach. And then finally, they gave me, there's a kit, I think, that they give you. And then also I had GAD, so I had to be put on antacids or something like that. Terrible experience, I can tell. Terrible. She's right. Like the angels had started flipping papers to look for my name.
So you had probably had it for a while.
And I had no idea I did.
And the other thing that usually causes ulcers is people, whenever you have abdominal pain, you take some painkillers. So there's a specific type of painkillers that makes it worse and injures the stomach.
So are they painkillers then? They're pain makers.
You're supposed to come to hospital, and we're supposed to figure it out. So these kind of painkillers are in the group of, let's say, diclofenac, piroxicam, indomethacin, ibuprofen. These kinds of painkillers are also very dangerous for the stomach. So this injures the stomach lining or the inside of the stomach and eventually creates a wound. Yeah, so the H. pylori issue, not everyone that has H. pylori has an ulcer. Yeah, it takes time.
So how does it actually start? Is it a food issue, or is it what's the main issue? What causes it?
The H. pylori, you mean?
Yes.
H. pylori is it's like a public health issue. It's a bacteria that you get from probably not washing your hands, eating without washing your hands. We call it a sort of like a fecal oral transmission.
Fecal oral.
Did you wash your hands?
But yeah, there's
actually this show is not for you.
There's other things like getting in touch with someone's body fluids that also has it.
Okay.
Yeah, so that can lead to spreading the.
So is that a bacteria, or what is this, a virus?
Yeah, it's actually bacteria.
It's a bacteria, but it's also a very important bacteria because studies have shown that it is a risk factor for developing gastric cancer. So we treat it seriously, and usually when you have it, we need to actually eradicate it, treat it so that it's gone. Because
what are the types of cancers that can happen in the digestive system?
So for cancer, anything, like we said, the digestive system has, I'll just say the parts for you. We have the esophagus, which we call the food pipe, which then leads into the stomach. Not what people commonly call the stomach. What people commonly call the stomach is the abdomen. Then from the stomach, you have what we call the small intestines.
Yes.
From the small intestines, you have the large intestines, and then leading to the rectum and the anal opening. So there are other organs that are related to that system, which is things like the pancreas, the liver, and the gallbladder. So you can get cancers from cancer of the food pipe, which is cancer of the esophagus, cancer of the stomach, cancer of the small intestines, cancer of the colon, cancer of the rectum, cancer of the anal area. You can also get cancer of pancreas, cancer of the gallbladder.
It's a lot.
Doctor.
And cancer of the liver.
Let's rest a bit, because now, but maybe when we come back, we'll have to know, can you treat H. pylori and actually have it completely eradicated?
106.1 Next Radio. We'll be right back.
Yeah, he will come back.
Small things like that.
Yeah.
Yeah, so...
Yeah. So what are some of the misconceptions that we're missing, especially about digestive system issues? Are there any misconceptions that have festered on over time? Like, this is how you treat this, or this is... in your field, have you seen any misconceptions that need to be dealt with?
Yeah, I think the first thing is exactly the first thing that you mentioned when we started, which is ulcers. So ulcers, really, to diagnose ulcers, you actually have to do an endoscopy. Just because someone tests you and says your H. pylori you have an active H. pylori infection, doesn't actually mean that you have ulcers. Yeah, for us to pick up an ulcer that is a wound, we actually need to see it. And that is, I think, the major thing I see in clinic. People come in and the first thing they say is, "Doctor, I have ulcers."
But also, some of the doctors also ask you, do you know, some doctors will go ahead and, do you have ulcers?
Yes.
And I'm like, how
How
am I
can I
supposed to
know?
That's a real thing.
Yeah, because I think we are used to the terms that the patients use, but
okay.
Yeah.
Okay, so are
Just
they
to
doing
get
that on
along with the
purpose? Just to they're doing that for us?
Yeah, I think they're doing it for you so that you're comfortable and more expressive.
I thought maybe I was not going to go back to that doctor because
he's doing it for you.
Incompetent.
Dr. Treasure, does family history play any role in, because every time we talk about these diseases, some people tell you, there's certain things you're going to get because diabetes, it's in your family line.
Is it hereditary?
Is it the same with these ulcers and such illnesses?
Yeah, so I like the question because I think family history is a very, very important thing.
Yeah.
But in this context, family history is very important for cancer. Yeah. So I deal a lot with colon cancer, and what you will come across in our setting is that not many of us know our family history. We have relatives that passed on. We don't know what happened.
We have no idea.
Yeah, we have no idea. So you find family history is so important, but mainly for cancers. I'll give you an example. Cancers are related. So, okay, maybe to simplify things, I'll just talk about there's different risks. We call it sort of being at risk. So there's things like being a high risk person or an average risk. So we say you're at high risk if you have a family history, especially a first degree family relative that has had cancer. To break it or to narrow it down, I will talk about colon cancer. So if you have a first degree relative, let's say first degree is parent, brother or child that has had, for example, colon cancer, you're at high risk. If you have a second degree relative, maybe more than two, you're also at high risk. So there are other cancers that also put you at high risk, not necessarily, let's say, colon cancer. If you have a family relative that has had things like ovarian cancer or uterine cancer, which we call maybe endometrial cancer, you're also at high risk of other cancers like colon cancer or gastric cancer.
So, doctor, if you talk about primary level, these are like your immediate siblings?
Yeah, family,
yeah,
parents.
first degree, yeah.
That's your close family.
Like brother, sister, child, yes. Then the second degree, uncle, auntie, grandparent. Yeah, so if you've had two of them have had, let's say, colon cancer, then you need to ask yourself the question. Yeah.
Sure.
And then maybe because now it looks like the cancers are many,
Yeah.
away from it being having something to do with family history, are there everyday foods that we consume that could be or render us be at risk for these cancers?
For food, not necessarily. It's mainly lifestyle. Things like alcohol, smoking.
Yeah.
Brewery.
It's it's a risk, but it's not.
When you say risk, because there's someone who's saying, I've done this, or I know of an uncle who's done this for his entire life, but the guy's come on.
Like functioning alcoholic.
That one has riziki.
Yeah, so that's why we call it a risk.
Yeah.
Just like getting a border every day, it's a risk. Yeah, but also you have to combine several factors. You can get onto a border. The driver is a drunkard, is driving very, very fast. I mean, those are so many risks. Or if you are taking so much alcohol, you have a high risk family history.
The cocktail.
Yes, or there are so many things. You are a chronic H. pylori candidate. Yeah, so many things coming together. You
had to include that.
But let's talk about how one can remain, or rather make sure that their digestive system remains healthy. Because the digestive system has a whole bunch really that affects us in many different ways. And I mean to the smallest part of, what do we call it, food poisoning, or even just a stomach bug of some sort, or whatever it may be. How can we make sure that we remain, or we have a healthy digestive system?
So I think one of the most important things is to be aware of your habits, aware of your body, aware of how you feel, and in terms of being aware, when something comes up, you are attentive to it and you seek the right professional opinion or help. But also things like taking plenty of water, things like doing exercises, things like eating a balanced diet, having some fruits. It's very, very important. And the lifestyle things that we've talked about, reducing them, all those will keep your digestive system in check.
So are you saying that some of these diseases and bacteria and stuff that we suffer from can be avoidable?
Yes, they can. Yes,
we keep striving.
Doctor, we also have this thing of cleaning the stomach with that machine. It's called the
one where they're taking out the fecal matter.
We also need to tell people the truth, whether it works or not.
Does it work?
There's a place where they put a pipe.
And then they start removing things.
What's it called? What's the humble word?
The downer opening.
And the downer opening, they fix a pipe, and the machine keeps on pushing water in your stomach and pushing
like a vacuum.
it out.
I do not know why people do those things.
Are you serious?
Yes.
Oh my goodness.
Is it for vibes?
Oh wow.
I think so.
I think just doctor,
maybe you
just
can also educate me.
just stand a little.
Why do you do?
Just stand a little, look at this side, and say, I don't know why this man did that thing.
Did you at least feel lighter after?
But it's the thing that they're over advertising it, and it looks like
it's everywhere.
Yeah. Did you feel lighter?
the hesitation means
have a direct answer.
So we do something similar, but we do it for medical purposes. When we want to check your colon, that is when we want to do a colonoscopy. Like earlier I said, a colonoscopy is just a tube. It has a camera and light. So we push it through the anal opening, go all the way to the beginning of the colon. So for us to do that, we need to get all the fecal matter out, because remember, we are trying to see.
Yes.
So we can't see if there's fecal matter. So we give you medicine, which you take, and everything comes out. By the time you come to hospital, you're just passing water. And then we put the scope in. It's not painful, like Victoria said. I just want
I said
to
traumatizing.
I want people to know that endoscopies are not painful. We sedate people, but it's mild sedation. We call it conscious sedation. It's for a very, very short time.
But then again, Doctor, now that you talk about that you give people medicine and it washes everything out, is it okay for somebody to do it
For themselves, like
yes,
they have to take their worms out.
when they're not going to be doing any.
No, it's not okay, because we give you the medicine under instruction. We tell you how to take it. We tell you how to counter any issues, and we don't just give it to anyone. I mean, if you give it to an elderly person, something can happen. So if you do it frequently, or if you do it without medical opinion, what will happen is you could actually get sick.
What?
There's something called electrolytes in your body. Yeah, so you risk those electrolytes, and you'll end up coming to hospital sick. And then when we ask you, you'll tell us how you were trying
how you flushed.
Yeah, flush.
I'll tell you.
So what are you saying here about deworming?
No, deworming is different.
There's also something called
Deworming is-
detox, where you
Yeah.
take osmosis,
That's castor oil.
tea, those tea you
Yes, the
pour
tea
in oil.
Do you guys remember?
You take
Did you
hot
guys
water.
ever took Brooklocks?
Yeah.
That
Oh
you
my
get
gosh.
ginger, when you boil ginger in water and you squeeze it and then mix it with mint
Yeah.
and green apples. You
It'll
live
make
by
you
it.
work.
To detox.
And then you show up with abdominal pain.
Yeah.
106.1 Next Radio. We'll be right back.
Tata, our guests have brought you these chairs as a small
Talking about these old things, I've been watching videos lately. I don't know why they've been coming to me so much. Lemon mixed with what? Put one
know,
spoon
right?
of what? This one clears your liver. Then if you get ginger and you put onions or what, blend them together, drink at least 1 glass every day. So this one handles over your lungs. I don't know. It clears intestines. It's so much, doctor. Do you think there's a lot of misinformation going out to the public?
Yes. I think there's a lot of misinformation going out, but it's always important for people, in case they have issues, to come into the hospital, ask their doctors. Yeah, I think rather than, I know there's AI, there's internet out there, but yeah, don't believe everything you see in the media or hear.
Or anything that you read.
Or anything that you read, yeah.
Yeah. So what are the first steps that people can take from today? Like, for instance, today I want to get my gut health on point. What are some of the things that I can do almost immediately? Or what are some of the things that I can eliminate, and so on?
Yeah, so that's a very wide question, but I think if you have a symptom, if you have an issue that you've been dealing with for a while, I think best to go to the hospital and ask your doctor, or tell your doctor what you've been feeling. Like I said, duration is very important. If you have something that it keeps going on and it's a month, 2 months, 3 months, please don't wait. Go to the hospital. If you have something that comes up, you're okay before, and tomorrow you're not okay, please come to the hospital as well. I think that's the safest way. Yeah, and just to stay healthy, eat, drink healthy, drink a lot of water, do some exercise.
They drink healthy, friends. They're not saying your bottles. People might be saying, your doctor needs to tell us the quantity. What is good? The drink healthy is, these processed things. Let's begin with natural juice, for example, but plenty of water, of course.
Yeah, and I'm happy you said processed stuff. Yeah, processed foods, and it's not good. So yeah, just the healthy things, healthy juice, water. Yeah.
and we'll be good to go. I guess you heard it from the horse's mouth. Doctor, if someone wanted to come to you, where do they find you?
Yeah.
Probably someone is listening right now. They're saying, I think I need to have a conversation with him because, my stomach.
Yeah. If you want to come and have a chat, you can come to IMC, Wandegare. I'm usually there at 8 in the morning. Yeah. You'll find me there.
And then you'll have all your issues sorted. So we've been talking about something here. Victoria was saying, oh, no, sometimes you need to hold the gas. Me, I don't just release anyhow. I'm very respectable. How bad is it, doctor, for someone to hold back gas?
That's how you want to end this conversation.
Yeah, I can't believe you had to ask that.
No, this one is serious.
Well,
from of course, from the health perspective, but then later, of course, we'll also tell you, but you need to have etiquette. Don't just because doctor has said it's unhealthy to hold, and then you say, me, it doesn't matter the kind of meeting, I'll show you shoki. Guys.
So my secondary school teacher used to say, if you have very smelly gas, you eat very well. I think he was not far from it.
It means you eat well.
Yeah, that's what he used to say.
What?
So, but yeah,
No way.
passing gas is better than not passing.
But are you saying that if you're eating well, that's why it smells?
Hey.
For us, we're told the opposite. When it smells, something wrong. There's something dead in your tummy. That's what we were told.
You know, death begins from the bowel.
Oh my
If you
Lord.
think about it, I mean, you eat a healthy apple. Have you seen what comes out?
Yeah.
So
Yeah, it is well. It's okay.
So guys, don't hold back gas, but also Victoria will want to advise you, don't just also spoil the air anyhow.
In other words,
You want to talk to them, Victoria?
hold it back.
No, come
Keep
on.
it to yourself.
No, find a place. And then also, I will give this as advice as we get to the top of the hour. At your workplaces, at your church, or public places.
Yeah.
When you find someone getting isolated into corridors and corners, don't follow them. They're trying to find a
don't
safe
come
space.
close.
Yes. Why? we are trying to keep you
That
safe,
is
and you're
funny.
coming into. I mean, we're trying to say this is a war-torn area, and you're trying to come close. Don't.
But we want to check on you to see if you're
No,
okay.
wait. When I come back, we can talk. If you see me going 5 corridors, we're going up
No,
the
why
ladders.
don't you pretend like you're on the phone? You must pretend like you're on the phone, like, hey.
Let me first finish with the call. Doctor, finally, your words, doctors.
yeah. So before I go, I just want to to appeal to the public. This one I have to say before I go because it's very important. So colon cancer is on the rise. We are seeing about a 40% increase in